DRA, DRI, DRO, and DRL all use differential reinforcement, but they reinforce different response patterns. We will learn one decision rule, apply it to concrete examples, and then solve 20 questions. If you want to benchmark afterward, our free mock exam and quick study guide are at bcbmockexam.com. For now, listen for what earns reinforcement. Before choosing an acronym, ask 2 questions. What earns reinforcement? A named response, an incompatible response, target absence, or a lower rate? And what should change? The response, its physical possibility, its occurrence during a criterion, or its frequency? Those answers usually identify the correct branch. DRA reinforces one specified alternative response. The alternative does not have to be physically incompatible. In strong applications, it is useful, feasible, and often accesses the same functional outcome as the target. A break card that produces escape from a difficult task is DRA because that named card response earns reinforcement. Follow the complete contingency. A difficult task makes escape valuable. The learner hands over a break card, and staff provide a short break promptly. The teaching message is not merely to stop problem behavior. It is that this communication response works. A named replacement response producing the consequence is the DRA clue. A procedure can be DRA and still be weak. Check function, effort, immediacy, and consequence quality. If disruption produces a long break, while an appropriate request produces only a delayed pause, the target still has the better payoff. Treatment quality questions ask whether the alternative can realistically compete, not only whether DRA is named. A named alternative points to DRA. If the stem adds that the alternative and target cannot physically co-occur, DRI is more specific. If no alternative is named and reinforcement depends only on target absence, the relation is DRO. The target behavior does not determine the label. The stated contingency does. DRI is a specific form of DRA. A named alternative earns reinforcement, and that response cannot physically occur with the operationally defined target. Helpful or competing is not enough. Remaining seated and leaving the seat may be incompatible as defined, but using a checklist and humming can still occur together. Run the DRI test literally. Can the exact target and exact alternative occur at the same moment? If yes, DRI fails, although DRA may fit. If no, DRI may be the most specific label. Clear operational definitions matter because vague behavior names can hide possible co-occurrence. DRI sits inside the broader DRA family. Every DRI procedure reinforces an alternative, but DRI adds physical incompatibility. When both DRA and DRI are offered and the stem clearly establishes that the responses cannot co-occur, choose DRI because it captures the more specific relation. Do not call a response DRI merely because it is useful or likely to reduce the target. Saying help while tearing paper or marking a checklist while humming remains physically possible. Those may be DRA examples. DRI requires literal incompatibility between the defined response topographies. DRO makes reinforcement contingent on the target behavior being absent under a stated criterion. No particular alternative has to occur. A token after 5 minutes with no calling out is DRO, whether the learner is writing, listening, or sitting quietly. That flexibility also means DRO does not automatically teach a replacement skill. In whole interval DRO, the target must remain absent throughout the criterion before reinforcement is delivered. Momentary DRO checks absence only at the scheduled observation. A timer alone does not define DRO because DRL can also use intervals. The defining relation is reinforcement for target absence. Many different behaviors can occur during a successful DRO interval. That makes DRO flexible, but another response present at reinforcement may also be strengthened accidentally. In practice, monitor what the person is doing at delivery and add explicit alternative skill teaching when a useful replacement is needed. DRO and DRA can appear in the same package. DRO may reinforce periods without the target, while DRA strengthens a communication or coping response. When a question describes both, follow the final sentence. Identify the exact component being tested instead of assigning one label to the entire package. DRL reinforces a lower rate of the same response when some responding should remain. For example, reinforcement may follow no more than 3 appropriate questions during a lesson. The current criterion is lower, but not 0. A plan may thin criteria over time, but a step requiring 0 occurrences is classified as DRO. This graph shows questions decreasing from 18 to a criterion of 6 while the same response remains available. That is DRL logic. A downward trend alone does not prove DRL. The programmed rule must reinforce a lower permitted rate. If the requirement is no occurrences, the relation is DRO. DRL can use a full session count, a non-zero interval count, or a minimum time between responses. These formats look different, but all preserve some responding at a reduced rate. Do not classify by the presence of a timer. Ask whether the criterion permits the response and reinforces a lower rate. DRL fits behavior that is useful in moderation, such as appropriate questions or reassurance requests, but excessive for the context. It is a poor fit when the goal is complete absence or when any occurrence creates unacceptable risk. Clinical use still requires assessment, social validity, and client-informed goals. Use the reinforced event to separate the procedures. DRA reinforces a named alternative. DRI reinforces a physically incompatible alternative. DRO reinforces target absence. DRL reinforces the same response at a lower rate or with greater spacing. Complete this sentence. Reinforcement follows blank before choosing the label. For a crowded stem, use this order. If the same response should remain at a lower level, consider DRL. If reinforcement requires target absence, consider DRO. If a specific alternative earns reinforcement, consider DRA. Then ask whether that alternative is physically incompatible, which makes DRI more specific. The same target can produce 4 labels because the contingency changes. A movement break request is DRA. A clearly incompatible seated response may be DRI. 5 minutes with no leaving is DRO. No more than 2 departures is DRL. Always label what contacts reinforcement, not the target behavior itself. A correct acronym is not a complete treatment plan. Check function, effort, implementation integrity, social validity, safety, and contextual fit. Monitor unwanted effects. Extinction can produce temporary increases or resurgence. DRO can strengthen another response accidentally, and an unnatural DRI posture can block participation. Teach efficient alternatives, collect side effect data, and adjust criteria with the client and team. Now apply the decision rule to 20 questions. Listen for what earns reinforcement and what should change. Pause before each reveal. On the explanation page, we will announce the answer once, identify the controlling relation, and evaluate each distractor in the context of that question. Question 1. A learner screams to escape difficult tasks. The behavior analyst teaches the learner to hand over a break card and delivers a short break after card use. Which differential reinforcement procedure is the clearest label for reinforcing the card response? The choices are A. DRO, B. DRA, C. DRI, D. DRL. Separate the target from the response being classified. Pause and choose. The best answer is B. DRA. The plan reinforces a named alternative that accesses the same functional outcome. Compare the other options. A. DRO would require absence of screaming, not a named card response. C. Card use is not physically incompatible with every possible scream. D. The goal is replacement, not a lower acceptable screaming rate. When a stem names a useful replacement response, start with DRA. Question 2. A client scratches their forearms during brief waiting periods. Staff reinforce holding a large foam activity ball with both hands throughout the wait. As operationally defined, the client cannot scratch either forearm while both hands remain on the ball. What is the most specific procedure? The choices are A. DRA, B. DRO, C. DRI, D. DRL. Compare the two operationally defined responses. Pause and choose. The most precise choice is C, DRI. The alternative is physically incompatible with the target response. Now eliminate the distractors. A, DRA is broadly true, but DRI captures the added incompatibility. B, reinforcement depends on a named response, not merely no scratching. D, the plan does not preserve scratching at a lower rate. If the alternative and target are physically impossible together, choose DRI. Question 3. During circle time, a token is delivered after every 4-minute interval in which no calling out occurs. Any appropriate behavior may occur during the interval. No particular alternative response is required. Which procedure is described? The choices are A, DRO, B, DRA, C, DRI, D, DRL. Ask whether any particular alternative is required. Pause and choose. Choose A, DRO. DRO reinforces the absence of the target behavior for a stated criterion. Use the same relation on the rest. B, DRA requires a specific alternative response to earn reinforcement. C, no physically incompatible response is identified. D, the interval criterion requires 0 calling out, not a lower count. Absence plus no named replacement response is the classic DRO pattern. Question 4. A student asks academically relevant questions 18 times per lesson. The team wants to preserve question asking, but reduce it to no more than 6 times per lesson. Reinforcement is delivered when the student meets that criterion. Which procedure best fits? The choices are A, DRI, B, DRA, C, DRO, D, DRL. Track the baseline, criterion, and fate of the original response. Pause and choose. The correct selection is D, DRL. DRL reinforces responding at or below a reduced rate criterion. The remaining choices change the contingency. A, no physically incompatible replacement is being reinforced. B, the same response remains. It is not replaced by another response. C, DRO would require no question asking during the criterion. A non-zero goal is the decisive clue for DRL. Question 5. A learner receives a break after using a top break request. Because of current staffing limits, task refusal still occasionally produces a brief delay before work resumes. Which statement is most accurate? The choices are A, the plan is DRO because refusal is sometimes absent. B, differential reinforcement cannot occur until extinction is perfect. C, reinforcing the named break request is DRA. Extinction is a separate treatment dimension. D, the plan is DRL because refusal still occurs. Separate alternative reinforcement from extinction. Pause and choose. The programmed relation matches C. Reinforcing the named break request is DRA. Extinction is a separate treatment dimension. That is DRA. Extinction can strengthen the contrast, but is not required for the label. Check the other letters. A, DRO would make reinforcement depend on refusal being absent, which is not the stated relation. B, the BCBA content explicitly includes differential reinforcement with and without extinction. D, no lower acceptable rate of refusal is used as the reinforcement criterion. Label the stated reinforcement contingency first. Evaluate extinction as a separate design feature. Question 6. A student tears worksheets to escape writing. The student is taught to say, "Help, please," and receives assistance for that request. The student could physically say the phrase while beginning to tear paper. Which procedure best labels reinforcement of the help request? The choices are A, DRI, B, DRA, C, DRO, D, DRL. Test the named response and physical co-occurrence separately. Pause and choose. The evidence supports B, DRA. DRA does not require physical incompatibility. Each alternative misses a stated detail. A, the two responses are not physically impossible together. C, reinforcement is not based solely on no worksheet tearing. D, the plan replaces tearing rather than preserves a lower rate. Do not upgrade DRA to DRI unless simultaneous occurrence is physically impossible. Question 7. A client makes appropriate reassurance requests so frequently that conversation is disrupted. Staff reinforce a reassurance request only when at least 10 minutes have elapsed since the previous request. Which procedure is being used? The choices are A. DRA, B. DRO, C. DRI, D. DRL. Focus on the timing rule for the same response. Pause and choose. For this stem, select D. DRL. This is spaced responding DRL. The response remains, but becomes less frequent. Test the remaining options. A. No different alternative response replaces reassurance requests. B. A reassurance request can still earn reinforcement after sufficient time. C. No incompatible response is specified. A minimum inter-response time is a spaced responding DRL clue. Question 8. A token is delivered after each 3-minute period with no hand-biting. During some target-free periods, the client engages in disruptive vocalizations, yet the token is still delivered because hand-biting was absent. Which analysis is best? The choices are A. It is DRO for hand-biting, but the arrangement may accidentally reinforce another undesirable response. B. It is DRI because vocalizing prevents hand-biting. C. It is DRA because vocalizing is the named alternative. D. It is DRL because the interval is timed. Label the contingency, then assess the possible side effect. Pause and choose. The most defensible answer is A. It is DRO for hand-biting, but the arrangement may accidentally reinforce another undesirable response. This is DRO, with possible accidental reinforcement of another response. The distractors describe neighboring relations. B. The stem never establishes that vocalizing and hand-biting are physically incompatible. C. Vocalizing is not a selected replacement response in this plan. D. A timed interval does not make a scheduled DRL when the criterion is target absence. After labeling DRO, check what other behavior may be occurring when reinforcement is delivered. Question 9. A learner hits to obtain adult attention. Which plan is the clearest example of function-matched DRA? The choices are A. Deliver a token after 5 minutes with no hitting. B. Reinforce tapping an adult's shoulder with attention. C. Reinforce holding a large clipboard with both hands. D. Reinforce no more than 2 hits per hour. Match the alternative to the maintaining outcome. Pause and choose. This item resolves to be reinforce tapping an adult's shoulder with attention. Tapping the shoulder is an alternative communication response reinforced with attention. Now rule out the alternatives. A. This is DRO because reinforcement depends on no hitting. C. This may be incompatible, but it does not access attention as described. D. This is a lower rate criterion, which describes DRL. 4 treatment quality questions. Check both the schedule label and functional relevance. Question 10. A student asks the teacher to recheck completed answers 9 times during a study period. Assessment identifies no safety concern, and the student agrees to a goal of 3 or fewer checks. Reinforcement is delivered at the end of the period when that total is met. Which procedure is described? The choices are A. DRO, B. DRA, C. DRI, D. DRL. Identify whether the criterion covers the whole session. Pause and choose. The precise answer is D. DRL. This is full session DRL because the same response remains at a lower rate. Compare what each option reinforces. A. DRO would require no answer check request during the criterion. B. No different response replaces the answer check request. C. No incompatible behavior is reinforced. A total session count plus a non-zero ceiling points to full session DRL. Question 11. A client bites the back of the hand. The program reinforces keeping both palms flat on the table. While both palms remain flat on the tabletop, biting the back of either hand cannot occur. What is the most specific label? The choices are A. DRO, B. DRL, C. DRI, D. DRA. Use the exact topographies for the co-occurrence test. Pause and choose. The best answer is C, DRI. Both palms flat and hand biting are incompatible at the same moment. Compare the other options. A specific incompatible posture, not mere absence, earns reinforcement. B. The goal is not a reduced number of bites. D. DRA is true generally, but less specific than DRI. Test literal physical co-occurrence, not whether the two behaviors are merely unlikely. Question 12. A supervisor notes that a plan delivers reinforcement after 10 minutes with no aggression, but does not identify or teach a communication response. Which description is most accurate? The choices are A. It is DRO and may need an added replacement skill component. B. It is DRA because any other behavior can occur. C. It is DRI because aggression is absent. D. It is DRL because the interval is timed. First label the schedule, then assess the missing skill. Pause and choose. The most precise choice is A. It is DRO and may need an added replacement skill component. That contingency is DRO. The absence of a replacement skill is a treatment design limitation. Now eliminate the distractors. B. DRA requires a specified alternative response. C. Absence alone does not identify an incompatible response. D. A timed interval does not make a scheduled DRL. First label the stated contingency, then evaluate what the plan is missing. Question 13. Escape maintain disruption reliably produces a 5-minute break. A new plan reinforces an appropriate break request with only a 10-second pause, while disruption still produces the 5-minute break. Which revision best strengthens the DRA relation? The choices are A. Add a DRO interval without changing outcomes. B. Make the appropriate request produce an efficient, function-matched break. C. Require an incompatible posture during all tasks. D. Reinforce a lower rate of disruption. Compare the target and replacement outcomes. Pause and choose. Choose B. Make the appropriate request produce an efficient, function-matched break. A function-matched, efficient consequence makes the alternative more competitive. Use the same relation on the rest. A. Adding absence-based reinforcement does not repair the weak alternative outcome. C. An imposed posture does not teach efficient functional communication. D. Preserving disruption at a lower rate conflicts with the replacement goal. For DRA, ask whether the replacement response works well enough to compete. Question 14. A student hums during independent work. Staff reinforce quietly using a visual checklist. The student can briefly hum while looking at or marking the checklist. Which label best describes reinforcement of checklist use? The choices are A. DRO, B. DRL, C. DRA, D. DRI. Check whether the named alternative is physically incompatible. Pause and choose. The correct selection is C. DRA. The plan reinforces a specific alternative without physical incompatibility. The remaining choices change the contingency. A. Checklist use, not simply no humming, produces reinforcement. B. The plan does not set a lower humming rate criterion. D. The two responses can physically co-occur. Competing, helpful, or unlikely to co-occur is not the same as physically incompatible. Question 15. A learner makes repeated appropriate bids for teacher attention. Each 15-minute interval earns a point if the learner makes no more than 2 bids during that interval. Some bids are still acceptable. Which procedure is this? The choices are A. DRA, B. DRO, C. DRI, D. DRL. Distinguish a non-zero interval count from absence. Pause and choose. The programmed relation matches D. DRL. The interval uses a lower, non-zero response count criterion. Check the other letters. A. No different alternative response is reinforced. B. DRO would require 0 bids within the interval. C. No incompatible response is specified. An interval alone does not mean DRO. Check whether 0 or a lower count is required. Question 16. At the end of each 5-minute interval, staff check whether a client is engaging in skin picking. If skin picking is absent at that exact moment, a token is delivered. No particular alternative response is required. Which procedure is represented? The choices are A. DRO, B. DRA, C. DRL, D. DRI. Notice whether absence is checked continuously or momentarily. Pause and choose. The evidence supports A. DRO. This is a momentary DRO arrangement because no named alternative is required. Each alternative misses a stated detail. B. No specific alternative response earns the token. C. No lower non-zero rate criterion is stated. D. No physically incompatible response is identified. The timing format can vary. The defining DRO relation is reinforcement for target absence. Question 17. A treatment package teaches a client to request attention, provides attention for that request, and withholds attention after shouting. The question asks specifically for the procedure used to strengthen the request. Which answer is best? The choices are A. Extinction, B. DRA, C. DRO, D. DRL. Follow the final sentence to one package component. Pause and choose. For this stem, select B. DRA. Strengthening a named alternative response is DRA. Test the remaining options. A. Extinction describes withholding attention after shouting, a different component. C. Reinforcement is tied to a request, not general absence of shouting. D. No lower shouting rate criterion is used. In multi-component plans, answer the relation named in the final sentence. Question 18. The client and team identify hand flapping as interfering with a client-selected cooperative activity. A plan reinforces keeping both hands flat on the thighs because that posture is incompatible with hand flapping, but also prevents use of materials and gestures. Which statement is best? The choices are A. It is DRO because hand flapping is absent. B. The plan should remain unchanged because every DRI is automatically appropriate. C. The contingency is DRI, but the alternative should be revised for social validity and contextual fit. D. It is DRL because hand flapping may decrease. Separate the technical label from clinical fit. Pause and choose. The most defensible answer is C. The contingency is DRI, but the alternative should be revised for social validity and contextual fit. The contingency is DRI, but the alternative lacks social validity and contextual fit. The distractors describe neighboring relations. A. A named incompatible posture, not target absence alone, earns reinforcement. B. A correct DRI label does not make a restrictive or disruptive alternative clinically appropriate. D. No lower rate reinforcement criterion is described. After naming the procedure, ask whether the reinforced response is useful, feasible, and client-centered. Question 19. A student raises a hand appropriately, but does so frequently that peers rarely participate. After reviewing class data with the student, the team agrees to preserve participation while reducing hand raises from 20 to 5 per class. Which procedure best matches that goal? The choices are A. DRO, B. DRA, C. DRI, D. DRL. Track whether the same appropriate response should remain. Pause and choose. This item resolves to D. DRL. DRL is designed for reducing, not eliminating, a response. Now rule out the alternatives. A. DRO would require periods with no hand raising. B. The team is not replacing hand raising with a different response. C. No physically incompatible behavior is taught. Behavior quality and treatment goal matter. Appropriate and moderation points to DRL. Question 20. Two plans use 10-minute intervals. Plan 1 reinforces 0 interruptions in the interval. Plan 2 reinforces 2 or fewer interruptions in the interval. Which classification is correct? The choices are A. Plan 1 is DRO. Plan 2 is DRL. B. Both plans are DRO. C. Plan 1 is DRI. Plan 2 is DRA. D. Both plans are DRL. Compare 0 with a lower permitted count. Pause and choose. The precise answer is A. Plan 1 is DRO, Plan 2 is DRL. Zero interruptions is DRO, while 2 or fewer is interval DRL. Compare what each option reinforces. B. Plan 2 permits responding, so it is not DRO. C. Neither plan specifies a named alternative or incompatible response. D. Plan 1 does not preserve a lower non-zero rate. Do not label by the timer. Label by whether the criterion is 0 or lower. Final rule. DRA reinforces a specific alternative. DRI adds physical incompatibility. DRO reinforces target absence. DRL preserves the same response at a lower rate or greater spacing. When a question feels complicated, state what earns reinforcement and what change is intended. Keep practicing with our 2 free resources. Take the free BCBA mock exam to test transfer. Then use the quick study guide to review the concepts behind any misses. Both complete links are shown on screen.